Before watching the video, please don't forget to like, share and subscribe to our channel by clicking subscribe button and clicking the bell icon to be notified whenever we upload a new video. Oranges are a type of low-calorie, highly nutritious citrus fruit. As part of a healthful and varied diet, oranges contribute to strong, clear skin and can help lower a person's risk of many conditions. This popular citrus fruit is particularly known for its vitamin C content. However, oranges contain a range of other plant compounds and antioxidants that may reduce inflammation and work against disease. 11 Health benefits of orange. 1. Aid weight loss. Reports suggest that the fiber in oranges may promote satiety, which may contribute to weight loss. Whole oranges were found to promote satiety better than orange juice. The fiber in oranges can keep you full, and you end up eating less. You can substitute this low-calorie fruit for desserts, which will not leave you craving for sweets. 2. Regulate blood pressure levels. Oranges are rich in potassium, which helps regulate blood pressure. Some studies also suggest that commercial orange juice may have a significant effect on blood pressure and other associated ailments. 3. Lower cholesterol levels. Long-term intake of orange juice was associated with lower cholesterol levels in men and women. The juice could reduce total cholesterol levels and the levels of bad cholesterol. Oranges are rich in fiber. Some studies show that this fiber can help lower cholesterol levels in the liver and serum. Fiber may also prevent your digestive tract from absorbing cholesterol. It also is believed that in addition to fiber, vitamin C, potassium, and flavonoids in the fruit may also help lower cholesterol. 4. Promote heart health. Studies show that foods rich in vitamin C, like oranges, can help prevent heart disease by keeping cholesterol levels low. The vitamin C in the fruit also keeps blood from clotting. This prevents thrombosis and reduces the risk of a heart attack. The potassium in oranges, as discussed, can lower blood pressure and reduce the risk of cardiovascular diseases. 5. May aid diabetes treatment. In a Nigerian study, oranges along with other fruits were considered safe to be eaten by those with diabetes. This had to do with the healthy glycemic response the fruit had in the body. The pulpiness of the fruit serves as a great source of fiber. Fiber helps in slowing down the absorption of sugar and improving the blood sugar levels. 6. Prevent kidney stones. Citrate deficiency in urine can cause kidney stones. Oranges can help increase citrate levels in your urine, reducing the risk of kidney stones. Oranges also contain calcium that may reduce the risk of stones. 7. Help treat anemia. The vitamin C in oranges may promote iron absorption. Iron cannot be fully absorbed in the body without the help of vitamin C. Snacking on at least one orange every day may help in the treatment. Oranges contain folic acid as well. Some research shows that this nutrient may help prevent megaloblastic anemia, a blood disorder that causes fatigue. 8. Help boost immunity. Oranges are rich in vitamin C. Some research states that this nutrient can help boost immunity. Though there is no direct research stating oranges can promote immunity, its vitamin C content could help. The fruits contain many other essential nutrients like folate and copper, which may also promote immune health. 9. Reduce the risk of colon cancer. Some studies show that orange juice may help inhibit colon cancer. The fruit contains hesperidin, which is a flavonoid with chemopreventive potential. The fiber in oranges may help reduce the risk of colon cancer. Oranges also contain other important chemopreventive agents that help in this regard. However, some research states that a high intake of orange fruits may increase the risk of colorectal cancer in men. The mechanism behind this is yet to be studied. The fiber in oranges also helps treat constipation and aids digestion. It is believed that the less fructose in oranges makes them less likely to cause gas. 10. Promote eye health. You must have heard how orange-colored fruits and vegetables promote eye health and protect vision. Eating oranges can offer significant eye benefits as the flavonoids in them help boost vision health. Studies showed that participants who consumed oranges were found to have a reduced risk of age-related macular degeneration. 11. Help treat polycystic ovary syndrome. You should follow a diet that contains low glycemic index foods to combat polycystic ovary syndrome. Orange has a low glycemic index and is suitable for those with polycystic ovary syndrome. Oranges also improve insulin resistance, which is thought to be the origin of polycystic ovary syndrome. Oranges are quite popular. They taste refreshing, but more importantly, they contain important antioxidants that promote human health. Though oranges are common, they are available in different types that we may not be aware of. What are the side effects of eating too many oranges? Oranges are great for you, but only when consumed in moderation. As they are highly acidic, oranges may lead to heartburn if consumed in excess. They can also aggravate symptoms of gastroesophageal reflux disease. Due to their acidic content, eating too many oranges can also lead to indigestion. Consuming too many oranges may also cause abdominal pain. One study states the case of an individual who had developed severe abdominal pain after consuming oranges. Its high fiber content could be the reason. It is important you keep a check on the number of oranges you are consuming in a day. Are oranges good for pregnant women? Oranges are a nourishing addition to the diets of pregnant women. However, orange juices available in Tetra packs are not recommended as they may contain preservatives that may be harmful during this period. Can you eat oranges while breastfeeding? Your body needs more vitamin C during breastfeeding as compared to pregnancy. Oranges are excellent sources of vitamin C and work as wonderful energy boosters. They also help absorb more iron from food. Hence, you might want to eat oranges or drink orange juice while breastfeeding. However, you need to exercise constraint as oranges contain a high amount of citrus and acid. If your baby shows any symptoms after you start consuming oranges, please stop orange intake. Reintroduce after a few days to check for any side effects. Make sure to consult your doctor. Can you eat oranges on an empty stomach? No. Oranges are generally acidic, and eating them on an empty stomach may trigger symptoms of acid reflux. If you like the video, please give a thumbs up and share it with your friends. For more health benefits and tips, please subscribe to this channel. Thank you for watching.